having the oncology department here in Jackson that's only 60 miles away. And the quality of care that we get here, it takes that stress out of travel and motel time and those type of things. And I just think that we are very blessed.
Back in 1998, we started off with 3 patients, and now we see over 500 patients a year.
The oncology department at St. John's Hospital is probably the most active and, in one way, critical service that the hospital has to offer. I don't remember ever coming into this department without being impressed on how crowded it was. We're at the edge, at the cusp of a real population and industrial growth in these 2 counties. And it's really, really important that we be able to deal with the chronic disease with acute elements that's typical of cancer patients. And the thing that's a challenge is with cancer, you can't just give a shot or just take out an organ. You have to deal with the whole patient.
I work with a great group of nurses who are very caring, compassionate, are always willing to go above and beyond.
I recently took on the role of navigator for the department. The role was really designed to help facilitate care of a patient from initiation of diagnosis, from that very first day that they learn about their disease, and sort of carry them through their process even into survivorship. A lot of times it turns into just listening and guiding and giving reassurance.
I don't know where you could get better service or better staff. They're always friendly. You can be down and they bring you up. I'm actually here. I'm 10 minutes from home. I can walk here. I don't have to drive 3 or 4 or 5 hours to get good treatment.
One great addition that we are going to implement soon in the oncology department is a device called the Sapien machine. So it'll save patients the extra step of having to get any radiation.
Our PICC line insertion rates have increased tenfold. The patients are happier with the location. We can choose the veins we want to use. We're eliminating need for extra x-rays to check placement because we already know that they're in place because of the device that we now have. It's just been awesome to have here.
The aftercare and the survivorship time for that patient is just as essential and important as the initial time and education and the time that we spend with patients throughout their treatment.
What I have been noticing with patients when I see them for their routine follow-up with regard to their cancers is that often after their treatment, they have this sense of abandonment or feeling that they're not part of the department anymore. And so our survivorship program focuses on a very well-structured care plan that's helpful for not only their primary care providers in the community, but the patient, the oncologist, the nurse practitioner, nurses in the department to have a very well-delineated plan of care for the patient.
You are allowed really lengthy amounts of time with patients, and you really get to be a part of their families and their lives, and it's a blessing to be able to be a part of that and to be able to help someone.
I have been receiving the best possible care here that I could imagine. From diagnosis to treatment was right around 1 month, which was pretty incredible. My feeling is if I was in a big city, it would have taken anywhere 3 to 4 months to get the same thing done.
Some people initially think of St. John's Hospital is a small place, and how could anything as complicated as cancer treatment be done here? And they may start out at a big fancy place and then quickly find that maybe a lot of it can be done very effectively here.
We are so fortunate to have Dr. Ward come to our department. I've worked with many oncologists in different hospital settings, and I've never worked with a doctor that is so competent with such a kind demeanor for our patients.
The people there that take care of you, the RNs, are all just wonderful and very caring with you each time you come.
Space is too limited for the community growing the way it is.
The growth has been dramatic. When I first came up, we had just a couple of chairs and we were crammed into one little space, and now for several years the space has been increased and it seems to be full a lot of the time.
We're needing more equipment. We're needing more IV poles and blood pressure monitors, which just takes up really every last inch of space that we have.
for as big and for as many people that are treated here, it would just be good if you had more space.
You're going to need to have good doctors and good nurses and good technicians, but you're going to have a facility that encourages them and helps them give the type of compassionate service that is really necessary. I think the time for action is way overdue.
Oncology has been changing very dramatically, almost on a daily basis. Not only are the drugs changing, but also there's big changes in the way the diagnosis is made. The expansion of oncology is extremely important to the people of Jackson and to what this institution can do for the people.